What unexpected discoveries can a stomach biopsy reveal? A stomach biopsy might seem straightforward, but it can sometimes surprise even experienced doctors. Usually, it helps diagnose conditions like stomach cancer, gastritis, or infections such as Helicobacter pylori. But occasionally, the results show unexpected findings that can change the course of diagnosis and treatment. One rare but interesting discovery is the presence of tissue from nearby organs. For example, sometimes a biopsy might contain liver tissue. This can happen if a peptic ulcer penetrates deeply into the liver, a condition called peptic hepatitis. While very uncommon, this can mimic cancer on endoscopy, and finding liver tissue in the stomach lining can be a surprising clue for doctors. Biopsies can also reveal benign conditions that look like tumors. For instance, some ulcers or inflammatory lesions may form masses that resemble cancer. A biopsy helps clarify whether these are harmless or requiring further treatment, preventing unnecessary worry or invasive procedures. Another important discovery is the identification of precancerous changes. Chronic gastritis, atrophic gastritis, and intestinal metaplasia are conditions where the stomach lining undergoes changes that increase the risk of developing stomach cancer over time. These findings are often invisible without a biopsy, so catching them early can lead to closer monitoring or lifestyle adjustments to reduce risk. Sometimes, even when a patient has symptoms or abnormal imaging, biopsies show normal stomach lining. While this generally suggests a lower risk of cancer, studies indicate that people with persistent symptoms and normal biopsies might still have a long-term increased risk. This highlights the importance of ongoing medical follow-up, even when initial results seem reassuring. Biopsies can also uncover infections other than Helicobacter pylori. While H. pylori is the most common, other bacterial, viral, or inflammatory processes may be detected, especially if symptoms are unusual or persistent. Lastly, it's important to note that biopsy results are not always perfect. False negatives can happen if the sample misses cancerous areas or if the tumor is very heterogeneous. This is why doctors often recommend additional testing or repeat biopsies if suspicion remains high despite negative results. In the context of stomach cancer diagnosis and staging, these unexpected findings are vital. They help differentiate benign from malignant conditions, identify early precancerous changes, and sometimes reveal rare complications that mimic cancer. Even when biopsies show normal tissue, ongoing symptoms may warrant further investigation because of the potential long-term risks. Overall, a stomach biopsy is a powerful tool that can reveal much more than initially expected. It guides doctors in making accurate diagnoses, planning appropriate treatments, and monitoring patients over time. If you or someone you know is undergoing a biopsy, remember that these unexpected findings are part of the process that helps ensure the best possible care. Always consult healthcare professionals for personalized advice and follow their recommendations for ongoing health management.